everyone, I'm Sheila Punayo. Today I'm going to demonstrate care for nasal gastric tube. Inserting a nasal gastric tube. This method of introducing a tube through nose into stomach. The purposes are to feed client with the fluids with oral intake is not possible, to dilute and remove calcium poison, to instill ice-cold solution to control gastric bleeding, to prevent stress on the operated side by depressing stomach and secretion and gas, to relieve vomiting and distension. Here are the equipment that we are going to use. Nasal tube in appropriate size, syringe, adhesive tape, cotton balls, kidney tray, adhesive tape, stethoscope, clamp, marker pen, steel tray, and the disposable gloves.
Check the doctor's order for insertion of nasal gastric tube. This clarifies procedure and type of equipment required.
Yes, Doc. Hello, good morning. This is Sheila Punayo. I'm your caregiver today. May I know your name?
Yeah.
When was your birthday?
06,
Is that okay to check your band list? The procedure that we are going today, Naso-Gastric tube insertion. At the moment, you are unable to swallow food. Because of this, I'm going to insert fine tube through your nose into your stomach. It might be a little bit uncomfortable, but it should be too painful. If it does get uncomfortable, let me know, and we can stop. Are you okay to go ahead with the procedure?
Gather the equipments. Organizations provides accurate skill performance. Assess client's abdomen. Assessment determines presence of bowel sounds and amount of abdominal distension. Perform hand hygiene. Wear disposable gloves if available. Hand hygiene determines the spread of microorganisms, but sterile technique is not needed because the digestion tract is not sterile. Gloves protect from exposure to blood or body fluids. Assist the clients to high fallers position or 45 degrees. Unavailable to maintain upright position. Upright position is more natural for swallowing and protect against aspiration if the clients should vomit. Checking the nostrils. Check the nares of patency by asking the client to occlude one nostril and breathe normally through the other. Clean the nares by using cotton balls. Select the nostril through which air passes more easily. Tube passes more easily through the nostril with the largest opening. Measure the distance to insert the tube by placing. Place the tip of tube at client nostril extending to tip of earlobe. Extend it to the tip of sepal process. Mark tube with a marker pen or a piece of tape. Measurement ensures that the tube will be long enough to enter the client's stomach. Lubricant the tip of the tube at least 1 to 2 inches with a water-soluble lubricant. Lubricants produce friction and facilitates passage of the tube into the stomach. Inserting the tube. Insert the tube into the nostril while directing the tube downwards and backward, following the normal contour of the nasal passage. While inserting the tube reduces irritation and the likelihood of mucosal injury. The client may gag when the tube reaches the pharynx. The gag reflex stimulated by the tube. Instruct the client to touch his chin to his chest. Encourage him/her to swallow even if not fluids are permitted. Swallowing helps advance the tube, causes the epiglottis to cover the opening of the trachea, and helps stimulate gagging and coughing. Advance the tube in a downwards and backward direction when the client swallows. Stop when the client's breath. If gagging and coughing persist, check placement of tube with the tongue depressor and flashlight if necessary. Excessive coughing and gagging may occur if the tube has curled in the back of the throat. Keep advancing and tube until the marking or the tape marking is reached. Do not use force. Rotate the tube if it meets resistance. Forcing the tube may injure mucous membrane. While keeping one hand on the tube, verify the tube's placements in the stomach. Attach the syringe to the end of the tube and aspiration small amount of stomach content. Visualize aspiration content, checking the colors and consistency. The tube is in the stomach if these contents can be aspirated. Inject a small amount of air, 10 to 15 ml, into the naso-gastric tube. Secure the tube with tape to the client's nose. Be careful not to pull the tube too tightly against the nose. Constant pressure of the tube against the skin and mucous membrane causes tissue injury. Clamp the end of nasal gastric tube while you bend the tube by fingers not to open. Bending tube prevents the inducing of secretion. Put off and dispose the gloves. Perform hand hygiene to prevent the spread of infection. Replace and properly dispose of equipments to prepare for the next procedure. Record the date and times, the size of nasal gastric tube, the amount of color of drainage aspirated, and the relevant client's reaction. Sign the chart. Documentation provides coordination of care. Report to the senior staff to provide continuity of care.